How to use the reports. We have this comes right out of the decks. Have a look at that spider diagram, seeing which indicators your OHT appears to be close to the center. Here you're doing well as compared to other OHTs. There may be opportunities to improve, but you won't be able to easily find that from looking at other OHTs. Using the spider diagrams to see which indicators your OHT appears further to the outside, in that case, you know that many other OHTs are doing better than your OHT. Is that something that's important to you? Because you also have to think about, this is an area for improvement, but is it also a priority for our OHT? Do we have people that are willing and able to actually generate and make a difference that would relate to improving this indicator? So what does this indicator represent? Is that important to us? In which case you can use the provincial report forthcoming to find which other Ontario health teams are ahead of you, and maybe find out either from our webinars, because we do population-specific pieces, through communities of practice will be a great opportunity for you, through the Ontario Health-sponsored communities of practice, which are supported by other support groups like the RISE, like Ontario Health, like ourselves, in doing it. And then, thinking about indicators where the Ontario Health teams are most important, you can also look at that second part of the report by primary care model, material deprivation, or health grouping, to find out where you have that greatest opportunity for improvement. And those subgroups starting to point you to some of the conditions you need to look at beyond what you've just been doing in the past around improvement. So focusing that activity. You may need additional outreach, for example, in low users or non-roster patients. That's a different approach if you need to work within a family health team to better access care for that. So that's part of the uses of these. Every Ontario health team has received, someone in your team has received Excel data files with all 27 indicators, remain stratified by 4 approaches for fiscal years 2021-22 and 22-23. We will be posting all of these by February 15th online. For now, the person that we had as being your most contact, so you can email us. We've caught a few people in the chat, but you can also email oht.evaluation@utoronto.ca for more information. We'll find out who in your OHT received the reports. And we are making a simple online comparator tool to be able to create charts based on the HSPN reported data. So for example, OHT A and B, comparing emergency department visits, best managed elsewhere according to a primary care model. And then we still need to go and find out what it is about those 2 OHTs that are different and drive those results. This is data to inform decision-making. This is not decision-making.